Hi, welcome to Is This the Norm? I'm Rebecca.
I'm Heather. And I'm Laura. Okay, so today we're talking about the very rare inherited genetic condition called 5A reductase type 2 deficiency, which is a mouthful. But it's more commonly known to Dominicans as either Guevedoces or Machihembras. This very rare condition isn't so rare in the small village of Las Salinas. I may be saying some of these things wrong, but bear
It
with me
sounds
here,
good to
and I
me.
apologize if I am. You're convinced. Good. Okay, we got this. And Las Salinas is in the Dominican Republic. For those of you who are terrible with geography, like I am, the Dominican Republic is part of a small island divided, one half being the Dominican Republic and the other half being Haiti, which is just south of Florida between Cuba and Puerto Rico. Legend has it that this small village in the Dominican Republic was discovered by wandering cattle lost by Spanish settlers from the late 1400s. They found the cattle licking salt flats and discovered the unlimited resource that has been excavated throughout the years. And this is where the name of the small village comes from, because in Spanish, Salinas means salt flats. They still mine the salt flats in this area today, and some locals think that this mining has had an effect on their children's health. The condition starts with children identifying as girls and at the onset of puberty grow male genitalia. It was first studied in the 1970s by Dr. Julianne Imperato McKinley from Cornell Medical College in New York. And she did a lot of testing and biopsies to essentially just work backwards and reveal what was actually happening to these children. So these children are born with male chromosomes, an X chromosome and a Y chromosome, and are fully males in genetic makeup. But they have a deficiency of the 5A reductase enzyme, and this enzyme converts testosterone to its active form, dihydrotestosterone, which is probably more well known as DHT, which helps to grow male genitalia. So when these boys are born, their external genitalia growth pauses and can look ambiguous or very much like a clitoris and labia. Now, once these individuals hit puberty, a surge of the testosterone then picks up development right where it left off, and the testes drop into what were formerly identified as labia, and the penis grows from what was formerly identified as the clitoris. Does that all kind of make sense?
Yeah, but I mean,
Wild.
we know what a vagina looks like. Does it look
hmm
the same?
Well, sometimes it's ambiguous
Uh,
looking,
well,
but sometimes it's very much looks like a vagina, because testes can be, up inside the body. And then if just even with like normal development, some boys, their testes will be up high and then they'll drop later. So that isn't uncommon in itself. But like, yeah, the penis looks like a clitoris. So when the penis does start to grow um, at puberty, the clitoris, the opening for the urethra can, instead of being at the tip of the penis,
yeah.
can sometimes be underneath a little bit.
That's a
Wow.
genetic condition in itself that
Yeah,
happens.
so that can happen, but prior to this growth spurt during puberty, it very much looks like a vagina. And of course, you can't see pictures of it because
It's kids, and that's not
yeah, it's kind of wrong,
right.
right? But that's what the description and like animated pictures kind of describe.
Mm.
So
Yeah,
the
makes
name
sense.
Machihembras, which means first women, then men, and Guevedoces, testes at 12, are the names locals have given to this condition. It happens in about 1 in 90 boys born in Salinas, and it's a recessive trait, so it has to be inherited from each parent. I think that plays a role into why it's mostly isolated to this small
What's
village.
the population
Although,
of that village? Do you know?
oh, I don't know. I didn't look.
What's it called? Las Salinas?
Yeah, it's
Is that the
very
village? Here, let me
isolated,
look it up.
small, tiny little village.
Okay, so maybe like a few hundred.
I'll
So
look it
1
up.
in 90 is a very, very small. There's not very many of them. Couple at a time, maybe, in the village.
It says well, this was in 2012, so I don't know if this is really an accurate depiction, but in Las Salinas, Dominican Republic, it's
Oh, geez.
5,956 people in
That's not that
2012.
small of a village.
So it's,
Mm-hmm.
yeah, but for like 1 in 90,
Yeah.
I feel like that's high in
Yeah,
comparison to
that's a
the population.
Yeah.
those boys have some fellow boys that are the same as them, hopefully. Like there's like a little group of them maybe.
It's, it's
Yeah.
It's
So
so funny because I just look up the town and the first thing it talks about is this genetic condition,
Mhm.
Laura. Like that's like the biggest thing about this
Yeah,
population.
Mhm.
Anyways.
it's different.
yeah, it's fascinating. So there have been rare cases in places like Papua New Guinea and Turkey, but
Okay.
very, very, very rare. Not 1 in
Do they
90.
think that they come from that town in particular, like they migrated to
That's
a
what
new
I
place
wondered,
and
but
that's
there's
where it
not a
came
lot of
from, or they're not
information
sure?
about that. Because that was my question too, unless I just
Right,
didn't
makes
find it.
sense. So are you going to get into, I don't want to be ahead of you, are you going to get into like the psychological aspect of this for
Sure,
these children?
sure.
Yeah.
Yeah, yeah.
Oh my goodness. Can only imagine.
So basically these boys grow up until puberty with female names, wearing dresses, and playing with girls. So, that in itself, these boys are just really missing out on like how to interact with other boys naturally, right? They're missing those milestones and those social cues because they're kind of integrating with the girls instead. So the BBC did a documentary on two boys in Salinas called Countdown to Life: The Extraordinary Making of You. And it's where I first heard about this condition. They follow two boys. One was formerly known as Felicita and is now known as Johnny, and one who was in the midst of changing from being known as Carla and changing to being identified as Carlos. And it's a really good watch, and it goes into more details about those boys. So if you're interested, go watch it. I'm not going to go into too much detail. Now, the people of this village have had many boys experience this development, and it's well accepted. But kids are kids sometimes. And in Johnny's experience, he explains how his peers would tease him when he came back to school as Johnny, and he'd basically have to kind of prove himself with his fists. He'd get in fights with the boys. And one quote from Johnny, he explains how he felt when he was being exposed to girls' clothing and toys. And he says, I never liked to dress as a girl. And when they bought me toys for girls, I never bothered playing with them. When I saw a group of boys, I would stop to play ball with them. So there are some signs, before puberty that can kind of hint to him, like if he's constantly wanting to go play with the other boys. I would imagine that mothers and fathers are used to this and kind of keep an eye out for it. But for the most part, these men live completely normal lives as adults. Sometimes they have reduced sperm counts, a smaller penis size that is completely functional, and a small prostrate, and sparse facial hair and body hair growth. Because these men had small prostrates, this kind of sparked the interest of Roy
I'm just going to
Vagelos.
correct you. It's prostate.
Am I not saying that?
It sounds like you're saying
She's pulling a
prostrate.
Brit on us and
Oh.
throwing R's in there where they don't go. Yeah.
I'm
It's a prostate. It's
Sorry.
prostate.
I didn't even know I was doing it.
It was cute.
So
It was really cute.
anyways, Roy Vagelos, head of research at the pharmaceutical company Merck, was very interested in this.
How do you spell his last name? 'Cause I think you might be saying
Vagelos.
that wrong. Is it okay? Is he Spanish?
I don't know. He's not very relevant other than the fact that he was interested in these men.
Well, I'm just
because they
saying that
had,
people might correct you if he's Spanish because two L's make a Y sound.
there's not
Big
two
names.
L's in there.
Okay, never mind. I'm sorry.
Okay, so in his research, he developed the drug finasteride, which I'm sure you're familiar with, Heather, which is used to treat men with enlarged prostates and male pattern baldness. And also there can be some early intervention for these boys, such as like DHT creams to apply to the genitalia prior to puberty and genetic testing. But the genetic testing isn't accessible to people from Salinas because it's costly and they live in very remote village without access to advanced medical technology. And it's also not considered life-threatening, so there hasn't been advances to really offer this to them. And the DHT cream wouldn't be utilized by these people because more often than not, they don't even know that they are
Yeah.
deficient in the enzyme until they hit puberty and experience physical changes. So yeah, they continue to live with this condition being prevalent and accepting it as part of their culture.
Well, that's good. But I mean, there's like, it sounds like there's just no way to know before puberty. Like
Yeah.
if they're
I mean, I would imagine that, because they said sometimes it looks ambiguous or it very much looks like a vagina. I would imagine the ones that are kind of ambiguous looking, they're like, oh, well, there's a possibility.
I mean, if they had more advanced medicine, they'd be able to see if they have a uterus or not. And that would kind of indicate, like, if they don't have a uterus,
Right.
then obviously they're
Yeah,
not
like,
going to be a
well,
woman
you would
as an
think
adult.
ultrasounds are
But they're such as,
are pretty easy to
oh yeah,
come by, even
but not,
But if it looks like a vagina, it wouldn't cue you to even do the ultrasound initially.
maybe they should just
right.
But for the ones that look
Especially in a
ambiguous,
country
then
like
you
they,
could.
that.
they probably like could do that for all the kids.
Yeah, maybe. So, right.
Right, that's
So
crazy.
everyone gets a.
But you'd have to get like, I think it really circles back to because it's not life threatening. They're not
Right.
going to like put
Right.
a whole medical crew to go help
Right.
unless, at some point that becomes a priority and they, there's something else going on that causes it to be more life threatening
Right.
other than psychological. I mean, that's the problem is that for centuries and as we sit here today, the psychological effects of illnesses is downplayed or not as
Right.
important compared to other things, like somebody that's not getting enough oxygen to breathe
Right,
and
but it
live
could be
every
just
day.
as detrimental to your mental health. I mean, mental health sometimes is more
Right. That's
debilitating than physical impairments. I'm just, I know
right,
this
right. I
this
mean, that's what I'm saying is like that on the tier of what's important still
Yeah.
as we sit here today, mental illness is not
Right.
equivalent to somebody that even drank themselves to almost death and they get another liver, or somebody that smoked all their life and they're getting bypass surgery, those things, even though it's self-induced, that still takes priority of somebody that is born with something that they can't prevent or have no, fault at it. I'm not saying that people shouldn't have bypass surgery, but you see what I'm saying? I'm trying to make the
Right.
parallel of what is really important in society
Yeah, I
in
mean,
general.
in this village, it's somewhat accepted, but probably not fully accepted. But there are like maybe health aspects, like do they have trouble having children? With low sperm count.
Well, yeah, there's low sperm count. So, I mean, it could be hard, but not impossible.
Right. I don't know. There's
And
probably
I can't remember the condition where the urethra is underneath the head of the penis, but that causes issues too.
Mhm.
I think you're more at risk for infections and clogging, if I remember right. Like you
Sure.
have
That makes
it's
sense.
it's called hyper something. I don't remember. It's been a while since, but I've seen it in individuals, and it can cause issues, physically that can cause you problems. I don't remember. It's like hyper something or other.
Laura, what's the
Or
name of
hypo. I
the
can't remember.
island that's Haiti and Dominican Republic? Hispaniola? Am I remembering right? I think that's the name of the island.
I don't know the name of the
A
island.
side note that penicillin, hopefully I'm not remembering wrong, and everybody's like, you don't know what you're talking about, lady, but I'm pretty sure that's how they discovered penicillin, is because Haiti was the poor side of the island and Dominican Republic was the rich side. And there was like some serious infection or something going around, and people were like dropping like flies on the Dominican Republic side. And it wasn't happening on the poor side. And they figured out it was like moldy bread, like the poor people would eat it if it started to go moldy and the rich
Oh.
people wouldn't. I think that's how penicillin first started to get studied.
I know it was by accident that penicillin
Sounds legit.
was discovered.
I read
but I
I
don't
read it
remember
like
how.
decades ago. I'm old, so maybe.
Even if it's not true, it's a cool story.
I've told that story so many times, so hopefully it's right.
I know there was I remember reading or learning in college that it was by accident that I forget the guy's name, but I never learned anything about Haiti and Dominican Republic. But I think oftentimes things are discovered prior to Americans discovering it, and then Americans just claim it. I think that may have been the
Yeah.
case here.
Oh yeah,
Classic.
probably.
Classic claiming of something that isn't theirs,
Yeah,
right?
everything grand in the world that was ever discovered, and it was by Americans, right?
No.
The egocentrism is
Yeah, so
the
funny.
epitome of egocentrism.
Oh no, we saw it first.
I just can't imagine.
Well, I mean, that's just classic European issue also, that when I talk about mine, that we talk about in our next episode, it's the same thing.
Oh really?
It's just, taking it as their own.
Yeah.
Yeah, there's
Oh.
all kinds of everything that is like related to like a native island or country where Europeans came in and did their thing. It's never like in a positive, I shouldn't say never, but most of the time, not a positive influence on the native people.
Yeah. I mean,
I mean,
across the world,
history repeats itself.
Australia,
Right. I
Canada,
mean, I'm saying
United
Europeans
States,
because
Europeans, they
yeah,
all do it. We
yeah.
all
Commonly now it's all of the, you know, colonized, but we all came, from the US for the most part. We came as Europeans and intruded on natives and did our thing, which was never, good for the natives. And that's just history all around to anywhere Europeans go, Spanish, Dutch, you name it. It's not usually a good influence on the native population. So.
Yeah, so when they were when I was talking about the Spanish settlers when they settled in the Dominican Republic, they like Columbus days, they brought cattle with them. And sometimes cattle just like wander away or don't stay with the herd. That I just thought that was kind of funny how the cattle were drawn to the salt flats and they were licking the salt flats for salt, like cows and horses need like selenium and salt licks. And so these cows kind of wandered away to these salt flats, and that's how that little village was discovered. And, now they mine that. So the locals are like, I think the mining has something to do with why this is happening because it's been happening for a long time. Grandparents pass stories down to grandchildren and it continues. And even though it's genetic and it's a recessive trait, I think that's kind of an interesting story to hear and all the connections there with history and whatnot. But
Europeans, again.
yeah, well, that's why I was
Europeans are
bringing
your
that up.
story.
And then also, I didn't really mention it earlier, but sometimes the men who do experience this transition will keep their female names even as adults. And there was not a lot of like explanation as to why, but I would imagine like changing your name is difficult so there is a lot
Maybe
of like
some of them still
mental health.
identify as a woman. Wonder if there's like
Well, I'm
that kind
not
of aspect
sure.
to it. Like they grew up as a woman or not a girl, and so like that, this one guy you
Well,
talk
there's
about,
confusion there.
Johnny, where he actually,
Yeah,
yeah,
there's confusion there because your whole life you've been playing with girls and dolls. Well, most of it. And then now you've got to transition into like playing with the boys. Whereas like, for Johnny, he was like, I want to play with the boys. And so for him, it seemed like possibly an easier transition than for some, that maybe some were like, oh my gosh, like this is what I'm used to. And then now
who I
I need
am.
to, yeah. So like you're saying earlier, like the psychological aspect of it, even in a community that accepts you and is okay with it and understanding, and that you have several peers that have experienced it, there's a network of people you can talk to, that even then it's difficult,
Well, yeah,
right?
because you're not gonna think you're gonna be that one. Like as a kid growing up, you probably
Yeah.
know and hear about it, but you're like, that's not gonna be me. And then it is.
Yeah. And you got to
Well,
flip
and
your
you
whole
just
world
even
around.
touched on it, Laura. The kids will, kids will be kids,
Right.
which I'm
Right.
not okay with, that are hard on them. Like,
Mhm.
regardless of how many are actually in the population, it's still happening.
Yeah.
You're still going to get picked on. You're still going to have to prove yourself, which is super unfortunate. I'm sure there's like the silver lining is it made them a strong person and it like they know how to stand up for themselves, hopefully. But that's that one story. What about the stories where a kid was picked
Mm-hmm.
on and it didn't go that
Yeah,
way? You know,
at
like
the
Mhm.
worst
suicide
time
rate. I wonder what
already.
that looks
It's the
like.
worst. Like, I worked in a school that was K through 12,
This level
and
of n-
like sixth, seventh, eighth graders. Yeah, actually, like eighth graders specifically, but they are not nice people a lot of times.
Mhm.
They're buttheads. It's like the worst
Well, and
age.
also, like,
yeah.
even just naturally moving into
Yeah,
puberty is hard in itself, and so those kids are like, "Weird things are happening, I don't feel
right,
normal, I'm gonna pick on somebody else who's even more abnormal," or,
right.
that's a horrible way to put it, but even more different than me to kinda take the pressure off of me having to go through all this too, like, naturally, humans are very egocentric and
And
selfish,
we're
and
are we're
especially
very
at that age.
humans. The human psyche is like is prone
Yeah.
to not look kindly on the other, like somebody that's
Yes.
dissimilar. Like, I wonder how many times this is
Mhm.
going to come up in the stories that we talk about because it's already like, or episode 2, and it's a theme in both of them. So we need to work on that, humans.
Yeah, all of us, myself included. I mean, when somebody's different than me, I will look at them and be like, I would never do that." But why is that expectation of me okay to put on somebody else? Just because I wouldn't do it doesn't mean that it's not okay for somebody else to do it, right? Like, just very me, all about me.
Hmm.
So,
Well, yeah, I mean, like, not to bring up this is kind of my part of my career, but jurors do that.
right.
You know, that's
Yep.
how they judge the individual. Like, I would never do that.
Mhm.
I can't believe, like, what, that's even though they just always put themselves in that person's shoes.
Yeah,
And also a lot of the times I would make a better choice than,
right,
I wouldn't have done that. I mean, it leaks into everything we do as
right.
humans.
'Cause
For
even
sure. Like, even
doing
in
it
the
this
ER, like, that was another theme, probably you do it in the dental field. I mean, I know I did it in the ER where like, "Oh my god, I can't believe that mom with that kid," or whatever. And it's like, I had to get out of that mindset, which I've had this discussion with you before, Laura, where I'm like, I want a mom with her kid to come to the ER just so she can feel safe
right,
and like she's doing the right thing instead of making them feel bad about caring enough to come to the ER and, being put down like, "Why are you here for a fever?" Like, "Hey, she came to the ER for help. She didn't come here for fun. Nobody wants to be in the ER." So that mindset of like judging, like if I was a mom, I wouldn't have brought my kid to the ER. Well, maybe rightfully so, but that's irrelevant.
mhm.
Take care of your,
So
your patient
people
and
have to
the
have
and the child.
safe spaces, and maybe
Right,
she
right.
doesn't
And
have
if
a
we
safe
can't create
space in
that
at
for
home,
them,
so she has to go to the ER for it.
Or maybe her kid has a temperature of
right,
103 and she can't get it down. Like,
Right. Yeah, yeah, yeah.
right.
Right.
Yeah, and but you do this like I've seen this in healthcare staff where they're like, "Did you do a cool bath? Did you do ibuprofen and Tylenol and alternate them?" Maybe she doesn't know to do that. Of course, we do as
right,
Yeah.
RNs, but not every mom
exactly.
knows that. What if it's because the moms are going to be, like, I don't want to over medicate my kid.
And that's not
I
something
want to do
that,
the right thing. So she's coming to you or dad. I shouldn't say just
yeah,
moms, but parents, mom or dad, come to the ER because they want to make her doing what
yeah,
the
and
right
they're not
thing.
gonna
Mhm.
trust Google to answer their questions about their kid.
Well,
No,
and
they
medical professionals tell you not to trust
yeah,
Google.
exactly.
So if you can't trust Google and you can't ask them questions, then what do you
Right.
do?
Yeah,
I've been
you're
asked in the ER before, "Is this your first child?"
Wow.
Mhm.
I liked it because I liked kids and I liked babies, and if I could be there to make mom feel comfortable, like, it was always a way better experience for everybody
Yeah,
if I went in there and been like, "No, you come here, that's what we're here for."
yeah. That should
It
be the
is what it
normal
is.
response, not
Because
a surprising.
they come in and they feel already guilty for being there,
Yeah.
and I'm like,
Yeah,
"Don't."
they're
Well,
already
because before you go
thinking,
to the
yeah, they're
ER,
already thinking like, "Oh my god, should
should I
yeah, is this
not?
the right
Should
course
I
of
not?"
action? I don't know." Right.
Right.
So, I
So
mean, this is a word to all nursing and healthcare staff out there, like, I know it feels irritating and it feels trivial, but really just think about the psychological aspect behind it and why
mhm.
we do what we do versus making it a very objective black and white. Take the subjectivity of it, meaning how that mom is feeling or the dad is feeling
Right.
or whomever, the caregiver. And same goes with addicts. It's the same kind of thought process with addicts, and that's a whole
You have a human in your
other story.
chair.
But
You have a human being. Treat them like
and
this.
they
So.
are,
And
yeah, and
and
they
a lot of
have
times what
worth
I think
just
when I
like
have a
anybody
patient
else.
when I have a patient is, and I'm feeling frustrated towards them, I'm like, I just pretend that it's one of you guys, one of my sisters. I'm like, if this was one of my sisters, what would I say to them?
Be a lot meaner.
Yeah.
I can
That's what
guarantee
I'm
Maybe
that.
to you.
thinking.
Okay, if
Like,
it
I
were
don't think you should
Rebecca,
treat them
what
like
would I say to her?
it's rude.
Please don't treat them
Okay,
like
fine.
you treat us. Please
Treat them like they were one
please.
of my children.
That's even worse.
There you go. It's a little
Stop.
better.
No, it's not.
Sorry, you walked into that
Yeah.
one.
No,
Anyway,
everybody, I love my
kind of got off
children.
track again, but the psychological aspect of we're humans and shouldn't be based on anything else.
Yeah.
Yeah. The norm should be nice to your fellow humans. Don't be a jerk. Even if you're in 8th grade. Be nice.
Yeah.
To all of our 8th grade audience, please
8th
be
graders, you
nice.
need to be nicer. Period.
Yeah. Or at least tell them all, parents tell your 8th graders to be nice.
Well, we're keeping this
I
PC.
don't
We
think we're
forgot
gonna
to
be
mention
reaching
that.
8th graders.
Hey, we're not.
Yeah, trying to.
They won't let me cuss.
Yeah. Yeah, that's why you're gonna hear a lot of "Oh my goodness" from me, because what else can I say?
Yeah. Well, that's all that I have
Wow.
for Guevedoces. Thanks for
Well, thanks
listening
everybody for
in, everyone.
listening.
We appreciate having you here.
Bye, y'all.
Bye.
Bye.